Medical treatment of ectopic pregnancy, especially tubal pregnancy. What is the indication of using medical treatment of methotrexate? First, serum beta HCG should be less than 5,000, and there is another opinion less than 6,000. And sac size should be less than 3.5 centimeter. And sure, there is no fetal pulsation in ectopic pregnancy. And lastly, there is no tubal rupture or disturbed ectopic or severe intraperitoneal hemorrhage which contraindicate use of methotrexate. And lastly, there is no contraindication for methotrexate used like abnormality in blood picture or liver or renal function, or if there is breastfeeding, or if there is heterotopic pregnancy or suspected intra-presence coexisting intrauterine pregnancy. This figure is not so absolute, but to increase your success rate, the first four should be full, especially first three should be fulfilled. Precaution. The patient should not take folic acid because it decreases the activity of methotrexate and decrease success rate. Also, the patient should not take non-steroidal anti-inflammatory which affect renal clearance of this drug. Lastly, there is no sexual activity because this increase risk of rupture of tubal ectopic pregnancy. And lastly, the patient should decrease exposure to sunlight, which may predispose to skin reaction to methotrexate. What is the dosing or how to apply methotrexate or to give methotrexate for those patients? First, the regimen single dose about 50 milligram per cubic millimeter body surface area could be calculated from internet program how to calculate body surface area. And then this is the day of the administration of the drug regarded as day 1. Then follow up for after 4 days and 7 days. After 4 days, we should check another beta HCG, maybe increased or near the basal line, no problem. But the importance beta HCG at 7 days should be declined from those of 4 days by at least 15%. If decline less than 15%, I regard this failure of treatment and another course be needed, and then cycle be repeated. Another course, day 1, regard it as a new day 1, then repeat beta HCG also at a day 4 after the second dose and day 7, and compare decline in beta HCG or multiple dose or called folinic acid rescue. We give methotrexate 1 milligram per kilogram at day 1, 3, 4, 5, and 7. And in between this, we give folinic acid 0.1 milligram per kilogram at day 2, 4, 6, and 8. Like single dose, the day 1 is regarded baseline, then repeat beta HCG at 3 and 5 and 7 days. If decrease by 15% or more, this is good. But if we reach last day and there is no decrease by 15% day, we can give another dose of methotrexate and folinic acid. And if there is decrease by more than 15% in both two regimen, we should check beta HCG every week till become negative. Should the patient allowed to be pregnant, it's preferred to delay pregnancy at least 3 months after last dose of methotrexate to ensure that there is no methotrexate stored in the body which can cause congenital anomaly. Thanks a lot.